Hi, everyone. We hope that you are all really settling into your summer routine. And, you know, the kids and the parents are certainly hoping for some sort of summer normalcy around the corner. So we've got some advice for you on how to enjoy the summer safely with your kiddos from Dr. Todd Bell, a Texas Tech physician's pediatrician in Amarillo. Dr. Bell, thanks for being with us today, sir.
Happy to be here. Thanks for inviting me.
Before we get started, we always like to hear about all of our experts' journeys to Texas Tech. Can you kind of tell us yours, how you got to Amarillo?
Yeah, so I was actually out on the East Coast. I was out at a place called Duke, and we'd gone out to eat at a Mexican restaurant and came back from answering a page, and my 3-year-old daughter was eating the loco salsa with a spoon, and it wasn't phasing her. And so my wife and I actually decided we need to get back a little closer to where they actually know what real Tex-Mex is. And in our minds, the epicenter of Tex-Mex is the Texas Panhandle. And so we actually literally started calling up places that we could do academics in the Texas Panhandle. And there was an opening here at Amarillo. And so I called up Rodney Young, and he was kind enough to both hire me, and in the interim, while we were waiting to make all the arrangements, he would intermittently email me a copy of the Abuelo's menu. So just to keep me interested until we got out here.
That's awesome. There are several varieties of salsa at Abuelo's, so that makes
there are. And again, in West Texas, you can find hot salsa that's actually hot.
Well, we are so glad you're here. You have been instrumental in a whole host of things as far as the COVID response has gone here in the Texas Panhandle, from really helping to get the COVID-19 drive-through clinic off the ground, to coordinating a VTM response, to coordinating our campus response. You've been really, really helpful, and we are all so grateful for you. How do you feel, though, that the tone is, the atmosphere is in Amarillo right now? We've kind of gone through a couple of you know, waves of the feeling of COVID right now.
Yeah, you know, so our numbers across the Panhandle are dropping, and that's great. Obviously, that's what we want. The reason for that is the effect of the social distancing measures, and frankly, we just did I think the community did a great job of being able to adhere to that and create some space between themselves and their neighbors, and that created an opportunity for us to be able to make sure that we'd gotten ahead of things. I think that, and I can't remember who to attribute this to, but the point, I think, in the epidemiology of our COVID here in the Texas Panhandle is not that we're done with this, but rather that we're finished with song 1 and we pressed pause. Now we're pressing play again, and we're not still sure what the next song is. You know, how much of a jump is there going to be as we reopen things? I think that it's important that we continue to remain vigilant. I would encourage people to wear a mask and follow those CDC recommendations. I think that we are just going to have to continue to play it safe until we get to the point that we have a vaccine available. And at some point in the future, we'll all be able to do one big group hug down on 6th Street. But until then, we want to continue to practice that social distancing.
Good advice. One thing I do want to talk about today, though, as we do head into the summer, you are a pediatrician by trade, and so generally you're always working with kiddos. So I want to talk about this multisystem inflammatory syndrome in children that has been showing up in connection with COVID. Can you kind of talk through the symptoms, what it is, why it's happening, what parents can look out for?
Sure. So the first thing to know about it is, I think from a parent's perspective, is that this is still something that's really, really rare. It's a really uncommon thing. Now, we know that kids can get COVID, and the vast majority of kids who get infected have minimal symptoms or mild symptoms, or at most moderate symptoms. We don't see the severity of illness that we see in the adults. And there's several reasons that might be, but we just know that kids in general don't get as sick with this as what adults do. But we also know that kids can get infected. And if they can get infected, obviously they can then share it with others who are at high risk of complications. Specifically, though, the multisystem inflammatory response we don't know why some children have it and some don't. We know that it's very uncommon, but basically what happens is that you get a sort of a accelerated boost or a hyper response of the immune system, and you end up with a lot of inflammation. And that inflammation then can cause its own problems. So it can cause the blood vessels to be leaky. It can cause almost an immune or an allergic reaction to in different organs. So we get inflammation of different organs. That could include the lymph nodes. It could include the skin or the heart or the gut. So it can involve lots of different symptoms, hence its name. And that overwhelming inflammation or inflammatory response can actually be really dangerous. And so every once in a while, there's a kiddo who will actually end up in the intensive care unit. But again, this is really, really rare, and we don't have a good feel for why it occurs. In some ways, it's a little bit similar to another type of illness that we've known about for, frankly, since the early 60s, called Kawasaki syndrome. And Kawasaki is another inflammatory response. It's actually an inflammation of the blood vessels primarily. And it also seems to happen after, or oftentimes is triggered by, an infectious process. So this multi-system inflammatory response that we see with coronavirus seems to be similar to Kawasaki, even though it may not be exactly the same thing.
And so symptoms that parents need to look out for, a rash is involved, right, sometimes?
Sure, yeah, so there's actually a lot of things that can be involved. The first and probably most notable thing would be a fever that goes on for multiple days. And as a general rule, if we have a fever that lasts more than 4 days, then that's something that we think that parents should definitely let their pediatrician know about. We see that kids can have problems with bloodshot eyes or with skin rashes. They can have in both of those situations, that can happen because of changes in the blood flow in the blood vessels, which cause the blood vessels to kind of dilate open. That's part of that inflammatory response. Kids can get swollen lymph nodes, just like we see in Kawasaki, but they don't have to. They could have respiratory symptoms like they otherwise would with coronavirus. That could be a cough or feeling short of breath. But again, they don't always seem to have that. They could have issues with involving, excuse me, the heart, which could lead to breathing problems, or with the gut, which could cause issues with diarrhea or perhaps vomiting or abdominal pain. But again, they don't have to have those things either. We're still trying to sort out what are exactly the most common symptoms. And again, part of the reason it's hard to know is this is a really uncommon complication of an illness that right now is very common across the whole world.
So the key component to this discussion is, if you have a hunch, you need to see your child's pediatrician, right?
Yeah, so I think in general, you know, there's some basic things that parents should always be willing to pick up the phone, talk with their doctor, and see what they have to say. So if a kiddo seems to be having difficulty breathing, you need to talk to somebody. That child needs medical attention. If a child is not able to keep down enough fluid so that they look like they're getting dehydrated, regardless of what the cause is, that's something that we need to make sure that we fix or intervene on, because kids who are dehydrated can get pretty sick or can get even sicker. So we want to make sure that those things are triggers for parents. Specifically, if there's a fever that goes on for more than 4 days, I think that's something that parents need to talk with their doctor about. And if a kiddo just doesn't seem to be feeling right and isn't getting better after that usual day or two of when you get a little viral infection, some sort of virus or SSV, most kids get better after a couple of days and you see they're starting to improve. And if you're not seeing that, if your mother's antenna or dad's antenna are kind of tweaking there, saying there's something not right, well, pick up the phone, call your doctor, talk to them about it, and see if they think the child needs to be seen.
You guys are certainly seeing a lot of patients in the pediatrics department right now, and you are taking all the safety measures you need to keep everybody safe. So I just want to hit that home for sure.
Yeah, and I think that's something that, just like with everybody else, the medical system is having to adapt to this viral pandemic. None of us were as prepared for this as we should have been. And frankly, none of us, even if we were trying to be prepared, would have been as prepared as we would have liked to have been. So what we're doing is we're adapting. And so for example, here at Texas Tech, we require that everybody wear a mask. That's both the providers, the staff, pretty much anybody in the building, including the patients who are over the age of 2, everybody wears a mask. That helps keep everybody safe, not just our employees, but also our patients and their families. And with that, and making sure that you're doing a good job of hand sanitizing and taking care, make sure your kid doesn't lick the elevator door buttons, then those are great ways to be able to know that, hey, it's going to be okay to come to the doctor's office and come on in. We do still encourage, if somebody suspects that they have coronavirus or that their child or family member may have coronavirus, that they call first. Almost all doctors' offices have a protocol now set up of how they deal with someone who has suspected or confirmed coronavirus. They may want to see you in the parking lot. I sometimes do that with tuberculosis patients if we don't have a negative pressure room. They may want to take you into a different entrance or to a different waiting room or take you directly back so you don't go to the waiting room. So call first, but it's okay to be seen by your doctor.
Absolutely, great advice. So as parents are gearing up for sort of some kind of summer activity happening for those kiddos, things like going to daycare, maybe going to the swimming pool, maybe going on a trip, vacation, summer camps, things like that. How can parents really be cognizant and aware and feel confident that they're keeping their children safe when they send them out into the world again?
Yeah, so if I knew all the answers on that, I wouldn't worry as much about sending my daughter off to college this fall. I mean, we all want to keep our kids safe, right? And frankly, that doesn't change at any age. First of all, I think that parents probably should just come to the realization that there's not anything that you do that's going to keep your child entirely and completely safe. This is that's just the world that we live in, and there's not anything that we do, whether it's giving your child Tylenol or cooking chicken nuggets for dinner. Nothing that we do is entirely without risk. So the first thing we need to do is just be aware of that. So our objective is not to make the risk zero. The objective is to make the risk tolerable. And so I think that when we look at those activities, those summertime kid activities, I think that that's what our focus is. So there's a few general rules that I would suggest. One of them is that for the most part, outdoor activities are going to be lower risk for spreading coronavirus than indoor activities. If we have there's a small birthday party that my child's been invited to that we think we really need to go to, well, if that birthday party is being held out in the backyard, that's going to be a lower risk of disease spread than if we hold it inside. Likewise, smaller groups are going to be lower risk than bigger groups. If we decide that we're going to have 5 kids singing songs together out in a tent in the backyard, that's going to be lower risk than if we go to a big concert down at the Civic Center. So smaller groups are going to be lower risk than larger groups. Masks in children who are old enough to wear them are going to be safer than no masks. So if you're doing a activity that allows you to be able to wear a mask, then I would encourage you to do that. There's obviously some activities you can't do that. You can't wear a mask and go swimming. I get that. But on the other hand, if there's a activity that I'm going to send my kids off to, they're old enough to wear a mask, and they have that ability to do that, I'm going to encourage them to wear the mask. I totally realize that's hard to do in the young kids and even in the school age kids, but it's worth at least trying. We can normalize wearing a mask as a normal behavior, and kids will adapt to that pretty well. And then I think that clean hands are going to be a better situation than dirty hands. So teach your kids good hand hygiene. How do you use hand sanitizer? How do you wash your hands? It's not just slapping them under the sink or under the faucet for a moment and then pulling them out and wiping them on your jeans. That's not what we're talking about. How do they truly take care of their hands. So with those general rules out of the way, then there's a few specific things that I would potentially mention. I think that if somebody's going to a big group, for example, if they're going to be going to camp, and the camp has a lot of kids in it, those kids are going to interact. That's the whole reason to go to camp, is that they're going to have a lot of interactions. You know that at least some of those interactions are going to be closer than 6 feet. I would almost guarantee that some of those interactions are not going to include masks. And with those interactions, there's a chance that your kid could get coronavirus. So bearing in mind that the vast majority of kids who get coronavirus have very mild disease, you may still want to send your kid to camp, and that's perfectly fine. My son's going to camp later this summer. That's okay. That's a risk that we're willing to take because we think that it's important for him to be able to socialize with kiddos his own age. However, when he gets back from camp, he's not going to visit his grandparents for 2 weeks because even though he may have mild disease, we don't want to potentially put somebody at risk who would be at greater risk of complications from the disease. And that concept of quarantine, both perhaps before an activity, if you can get all the children in an activity to do that, and definitely after an activity that has potentially exposed somebody, those are really important. And I think that being aware of that when you're coming back from activities like camp is definitely a consideration. I think that for daycares, I think that it is really, really difficult to know what to do. People don't send their kids to daycare because they want them to socialize with other children. They send their kids to daycare usually because mama and daddy have to go to work. And that's the world we live in, and I get that. So when a child actually comes down with an illness, whether that be a runny nose or a cough or a fever, and they will come down with an illness, when a young child has an illness, then the parent needs to make an assessment of, all right, is this something that am I safe to go to work since my child is ill? If your child has a fever, has a cough, they shouldn't be going to daycare, that you need to stay home with them anyways. But if as that child improves, then the question is going to be, all right, can I go home and hold my child at home and still be able to safely go to work? Well, some of that's going to depend on where you work, perhaps, but a lot of it is actually going to be dependent on what's the cause of the kid's illness. Because even though coronavirus is something that we're all thinking about right now, there are hundreds and hundreds of other viruses and strains of viruses that can also cause similar symptoms in children. So if you're not sure, call your doctor, call your child's doctor, talk about it, and if need be tested so that you can have some security in your mind on doing that. I would say that there are a few occupations, for example, if someone works at a nursing home or a long-term care facility, they should not be going to work if they have a sick family member unless it is proven what the etiology of that illness is, and it's not something that could potentially spread in the nursing home.
Super good advice, really valuable. And I think that that's an important thing to kind of make parents feel safe, but also be cautious, right?
Right. And that's, I think, the take-home point. The reality is life goes on, even when we're all in self-isolation. It's nobody put a pause button on time while we were doing this. So we have to figure out a way to be able to keep our kids healthy and active and developing normally and be able to just live as a family. But we also need to be able to attenuate or mitigate that risk both to our children as well as to those around us, our friends and neighbors and family who are at greater risk of complications from disease than what the children have. One other category that I'd meant to mention, with summertime comes swimming. And so oftentimes we get questions about swimming pools. So can we go over to a swimming pool? Remember this same general rules about outdoors better than indoor and small groups better than a large group. That's going to apply with the swimming pool too. If you're in a swimming pool and you're splashing around and you've got some space between your family group that's swimming and the other family groups that are splashing around in the pool, then that's probably okay. The places you would want to watch are the places that the crowds kind of congregate. So around over at the locker rooms or the bathrooms or the snack bar. Those may be places that it's a little more risky. Again, outdoors is, if you're swimming at an outdoor pool, that's going to have a much lower risk of disease spread than if it's an indoor pool. Wouldn't be much of a pediatrician if I didn't remind people to wear sunscreen or a sun shirt in order to be able to protect your kids from that intense sun. Because even though the sun does a good job of killing off coronavirus, it also does a pretty good job of killing off our skin cells. And we only have that youthful childhood skin for a while, and eventually the sun gets it and people start looking like me as they get older.
I've been looking for a way to get that youthful childhood skin back, Dr. Bell. I'm working on it. If you find the answer, will you holler at me?
All right, I'll call you from the Bahamas where I'll be living. Patent that.
Well, very good. Okay, so that wraps up our serious portion of the interview. It's now time for the lightning round, the most famous part of these segments. Everyone looks forward to them. I hope you're ready. Okay, first question's a tough one, and I can't wait for your answer. Crunchy or smooth?
Probably crunchy.
Really? This shocks me. Do you have a reasoning behind your choice?
Yeah, I don't know. I guess it said that I grew up crunchy peanut butter, and so that is when I make a PB&J today, I still reach for the crunchy. And
for the crunchy.
My wife is a creamy peanut butter person, and it has caused some issues in our marriage, but we work through them. And it turns out she actually doesn't care much for peanut butter and jelly sandwiches anyway. So for the most part, we just buy crunchy.
Good advice. Favorite ice cream flavor?
Rocky Road. Also crunchy.
Okay. Also crunchy. You like some texture. All right. What is something that you like to do the old-fashioned way?
Everything.
I knew you were going to say that.
There's no school, or there's no school like the old school or something like that, I think is what it is. I'm a Luddite, and so for all the kids out there, they can Google Ludd. But I'm a Luddite, and I greatly prefer to do things by hand if I can. I don't do well with computers. I like to, I do a little bit of woodworking. I do that by hand. I just almost always prefer the old way of doing almost anything.
I pretty much agree with you. Okay, what would your spirit animal be?
It'd probably be a cow. So cows in general tend to be rather useful. I mean, we don't keep cows around really as pets. I mean, they're there because they're useful. They are able to survive in a semi-arid environments such as West Texas, so that seems like that'd be a good thing. I do a fair cow impersonation. I don't know if my voice is moist enough to do this, but I'll try. Let's hear. Hold on.
Well, that just happened. So that's great, Dr. Bell. Wow, way to go.
Does that fit into the lightning round segment?
Well, that's the first time it's happened. So maybe we'll add a question of best animal impersonation. You would already win, though. Clearly.
Actually, again, I don't know if my lips are wet enough, but my best is probably an elephant.
Oh, God. Oh, he needs a stethoscope. Okay, I'm ready.
So this is, you got to do it with the right age group of kid.
Uh-huh.
But sometimes the elephant tries to look for peanuts on the kid's back. It's when they're breath. So, all right.
I get it. That was good. That's really good. Right. And you know what, Dr. Bell? I had another question, but I feel like maybe we just wrap it at that. What could be better than the elephant impression?
Yeah, I do that. I end up bombing the end of a lot of interviews that they feel like they want to cut off.
No, I don't think you bombed it at all. You're a delight. Dr. Bell, thank you so much for talking with us today, and thank you for all the work that you've done. We appreciate you.
Thank you.